Welcome to Nursing School Explained, and this video on occluded central lines, which is a complication that can arise if a patient has a central line, and then we need to know how to troubleshoot it. So let's take a look at this. Number one, causes for central line occlusions can either be a blood clot or medication precipitation in the line, so medication that has built up there, and that is usually because we have not flushed the port or the length of the central line adequately, or because incompatible medications have been administered and they're now sitting in that IV line together and they're incompatible, forming some sort of crystals, and therefore we cannot push any more medication or even a simple normal saline flush through it. So signs and symptoms are going to be assessed by you, the nurse, because you're going to feel resistance to or be unable to flush the line. And then the nursing care associated here is we need to assess the lines frequently and make sure we follow our policies and procedures as to the frequency and whatever is required prior to administering medication, and also what the volume of flush is that we should be using here. And then we should be flushing per policies and procedures, Q12 hours, Q8 hours, whatever the case might be. And if we do note resistance to the flushing, we need to follow policies and procedures to possibly dissolve the clot. Now there's a caveat here. Not every patient is going to be a candidate for having that clot dissolved. It'll depend on the underlying circumstance. So if this is somebody with a bleeding disorder, or he just had a stroke and received thrombolytics, they're absolutely not going to be a candidate for this. But because central lines are very important and many times used in the critical care setting, we need to troubleshoot and consult with the whole healthcare team to see what is the best solution. And the way we can dissolve the clots is by possibly instilling thrombolytics just to the length of the line and then maybe taking them back out with the clot, or giving the patient anticoagulants. But again, we have to consult with the whole healthcare team to see what's best for the patient that's in front of us. So it's going to depend on individual qualities of the patient. And then there are special caps that we can hook up to the IV ports, and we can use those if they're in our policies and procedures. And these caps, they create a positive pressure on the line, which prevents backflow. So if the line is sitting in the patient's vein, and blood will typically flow back a little bit into that line. But if we apply this cap to the end of the IV line where the port is located outside of the patient's body, it kind of creates this positive pressure where that blood flow will not be allowed to into the tip of the catheter, and therefore we won't be having any clots. Of course, we need to still be sure that we don't administer incompatible medication and adequately flush the lines as per the policies and procedures. Please also check out the other videos on other central line complications like infiltration, extravasation, and air embolism. Give me a thumbs up and see you soon right here on Nursing School Explained. Thanks for watching.